Today we're going to demonstrate placement of a stock abutment or standard abutment from the Straumann implant system, as well as the impression technique. So if you're placing your own abutment, when you see the patient, you will have, the patient will present with a healing cap in position. The implant will already be checked for stability by me, so you should have no problem eliciting movement or discomfort as far as that goes. The first step is to remove the healing cap. Normally this can be done with finger pressure. Occasionally you may need to use a torque wrench to remove the healing cap. Once the healing cap is removed, you have a little bit of time to place your abutment before the tissue starts to collapse, but I certainly wouldn't drag your feet in this part of the procedure. The direct abutment or standard abutment comes in 3 heights for the regular neck connection, 4, 5.5, and 7. For the wide neck, it comes in 4 and 5.5. So you should have a good idea of the abutment height prior to placement. You simply finger tighten it, and then once you finger tighten it, you would want to check the occlusal clearance to make sure you're happy with the clearance. Once you're happy with that, then take your torque wrench and seat it. Using finger pressure to hold the torque wrench in position, Straumann is tightened it to 35 Newton centimeters. Once it's tightened, then it's time to take the impression. If I place the abutment for you, the patient will present with the abutment in position, and there's a gray protective cap for temporization purposes cemented on the abutment with temporary cement. If you see the patient like that, it's a simple matter to remove the protective cap. It can be removed with finger pressure. Sometimes a rongeur is necessary, but it's simple to remove. Once it's removed, the impression components for Straumann require 2 pieces, the white impression basket and the positioning cylinder, which is color-coded depending on the diameter and the length of the abutment. You take your white impression basket and seat it onto the implant itself. Once it's seated, you typically will hear a small audible snap, and it should also rotate fairly freely. And once it's in position, then the positioning cylinder is seated, and this is the most critical part, as it needs to be seated completely so there's not a gap between the impression basket and the positioning cylinder. If you have the positioning cylinder positioned incorrectly, with the flat side not lined up, the positioning cylinder will not seat entirely. Once it is the whole impression components are placed, then it's a matter of light body around your basket, and then seat your tray with your regular body or heavy body, and then remove the impression, and everything comes out into the impression. Then you should replace your protective cap just with temp bond, and that goes off to your lab. If I'm placing the abutment for you, I will provide you with an impression kit. In that kit will be an impression analog, as well as a burnout coping, so that you can give those to your lab. So that sums up the procedure for placing an abutment and impression technique for the Straumann standard abutment.